And now it's time for the Ask Dr. Tommy Show, featuring health news, opinion, and insight from Wesley Chapel's concierge medicine physician, Dr. Tommy McElroy.
And thank you for joining us today. This is the Ask Dr. Tommy Show. I'm Dr. Tommy McElroy, and I am a concierge medicine physician in Wesley Chapel, Florida. And today we have the honor of being with our Persian goddess of water, Dr. Azharian, who is here to share with us about breast surgery for cosmetic surgery for the breast. And today we also have our co-host today, Tracy.
Hi, thank you for allowing me to be a part of this today.
Oh, you're very welcome. And Dr. Azharian, how are you doing?
Great. Thank you for having me.
Well, thank you for coming in again. Your first podcast is the most famous podcast in the history of Ask Dr. Tommy Show. So,
oh wow!
So if you haven't seen it, it's the Cosmetic Surgery for Women podcast, and we invite you to go. And lots of people have already seen it.
Great.
Around the country, apparently. So tell us about plastic surgery, cosmetic surgery for breast, and you have there with us. You have it looks like 3 different options or 2 different options.
I have 3 different breasts here in my lab. So yeah, plastic surgery. Breast augmentation is the second most common plastic surgery procedure most people have done. Obviously, a lot of people do it to enlarge their breasts, but a lot of women after breastfeeding, pregnancy, weight loss, they lose a lot of volume, aging, and they like to replenish some of that volume and kind of get a fuller cup size. So we have all different types of people that come interested in the procedure.
What are the different varieties you have? I know there's saline, there's silicone.
There is saline, silicone. Here, I'll give it to you this way since you're in front of the camera. There's saline, which comes empty. Okay. And we actually filled it up with the great Florida water, and it evaporated, and we see all the calcifications that are in there. So,
what kind of water do you use if you...
it's saline. It's the injectable saline, same thing that would go into the IV when you go to the ER and you're dehydrated. Same thing goes in there. But it comes with this tubing. And we roll it up like a little cigar and make a tiny incision and put it under the muscle where it needs to go and inflate it with the saline depending on what volume they use. Yeah.
So when you're in the OR, you put the thing in there and then you size it first, and then once you figure out how much volume, because you can adjust. That's the difference between, I guess, saline and silicone, is that you can adjust on the fly, so to speak. Exactly.
It's better for patients. I mean, it's more economical, cost-friendly. For obvious reasons, but also in some patients that have a little bit of asymmetry, it's a better option. Okay. As long as they have enough tissue to cover it, because it will look pretty natural, and then we can play with the volume of it and get them a little bit more symmetrical than what they really are. But we basically, just like that, we put the little tubing in, roll it up like a little cigar, put it in, and when you inflate it like a air mattress, it opens up in there and it fills up.
Oh, cool. Okay. And then there's this little... Does this ever come undone? Does anybody ever complain about this?
No, we make sure that that little doodad is stuck in the little hole. Before.
So no complaints without popping out?
No complaints without popping out, but just like anything that's man-made, they have a potential to rupture. And when it does rupture, because there's saline in it, your body absorbs it, and one morning you wake up and you're deflated. Right. So you kind of need to call your plastic surgeon back up and go get it fixed, or get the other one out, or put a new one back in. Most of the implants these days are insured. I feel that. So for the silicones, there usually it comes part of it. The saline, I think you have to purchase a insurance policy for it, which insures it up to 10 years. And
that's for which one?
For saline.
Oh, okay.
Yeah. So you can get insurance up to 10 years, and if it is ruptured or something like that, they will cover the cost of new implants and some of your surgical fees.
What are those others you got there?
The other one is silicone. A lot of people are familiar with that. It's the round gel implants. They feel more natural.
It feels heavy.
It is heavy, but for some reason, once it's in, it doesn't really feel like heavy. It feels like it's part of you. They're pre-filled, so incisions are a little bit bigger. You have a little bit less wiggle room for if you're completely asymmetrical, but it feels more natural. It feels nicer. A lot of people know them as the gummies. But basically they're filled with silicone.
So this comes in different sizes, is what you're saying,
right? All of them come in different diameter sizes. I think it says it on the back of it what it is. So those are basically displays that we have.
415 cc's.
Right. They're displays.
It's pretty heavy though, doesn't it? It's amazing that you doesn't feel
they're pretty big implants. For somebody that's doing it for augmentation, they're pretty big.
Okay.
What is the so you say the incision's bigger. How much bigger is the incision if it's...
Depends on the size of the implant they choose. So the bigger the implant they choose, you have to be able to get it in. Now, for us, we use this special device that helps us get it in a smaller incision. It's called the funnel. Not all practices use that, so it's a little bit nicer added thing we have for our patients.
It goes up underneath.
What
right?
about-
I like to do it. There are different places you can put it. I like to do it underneath because it allows the best place for it to hide, especially if you're not having a lift with it. A lot less people walk around with their arms up in the air to show the under part of their breast, so it hides nicer.
Can you
Okay.
still have a subareolar incision with a silicone breast implant like this size?
You can. It is more difficult. I personally don't like that incision because there's some issues. Some people say that the scar, even though you try to hide it, it's still visible. So in my opinion, if you have nice shaped breasts, that's still more visible when you are nude compared to what's underneath.
Has someone requested that before to have the incision done there?
There are requests. So when you come for the consultation, we always go over all the different incisions, and I kind of give them my rationale. If somebody's insisting on it, then it's fine. But for the most part, the underneath, it heals better. Sometimes there's a question of, since a lot of people have bacteria in their mammary ducts, since you're going through it, are you potentially causing a contamination? So there are all these theories. But, I mean, it's perfectly valid incision to put.
Okay. And
So-
then we have one more.
So this last one is still a silicone. It's a shaped implant. It's been approved in Europe for a while, but it's been 2, maybe 3 years that it's been approved in the US. And if you put them side by side on the table, you'll see that this one holds its shape the other way. Yeah, no.
Which one?
Kind of like on the, yeah, exactly. If you hold it like that and then put the other one kind of on its side, you see that one kind of
So this is
smushes
like a
down.
teardrop?
Yes.
You see that, and then this one kind of holds its shape, so it gives you a little bit more of a, even though it's supposed to be more of a slope, a natural slope per se, rather than this rounded look.
Yeah, look at the difference.
It does actually give you more upper pole fullness, which a lot of women that are smaller chested, they've breastfed, they complain about. So it is the most expensive implant there is, but it does have some of its benefits. Of course, you have to be the right candidate for it. Not everybody is a candidate for it.
And this is the Ask Dr. Tommy show. When we come back, we're going to talk a little bit more about the types of breast implants that are available and then how much they cost. We'll be right back.
Hi there, this is Dr. Tommy McElroy. You didn't go to medical school so you could fill out paperwork. You got into medicine because you wanted to help people. You want to make a difference. You want to heal and connect with your patients. Atlas MD is the EMR that will help you get to where you always wanted to go. Learn how to transition your practice to direct care and learn more about Atlas MD EMR at atlas.md.
You see it when you put it side by side?
ATLAS.md.
And thank you for joining us again. This is the Ask Dr. Tommy show. I'm Dr. Tommy McElroy. And today we have Dr. Anahita Azharian in the office with us, and she is a plastic surgeon, and we're talking about breast augmentation. And so breast augmentation, what is the general price guidelines for breast augmentation?
So it all depends on if you need a lift or you don't need a lift. If it's just a straightforward breast augmentation, it depends on which implant you choose. Obviously, Saline is the cheapest. It's the least the quality one, I guess, if you want to say that, on the market. That they run about $4,500
Okay.
to $5,000, give or take.
Okay.
In this area, the round silicone gels run about $6,000. Some practices a little bit more than others. And the shaped ones, those are the most expensive. They're the newest on the market, so they actually cost a lot more. They're about 75-ish, 75.
This shaped one, I noticed it's got like a texture to it. It's almost like it's...
They are textured. Those are the only kind they make them. The round ones, we have the option between texture and round, but usually for cosmetic, we all use round. It just settles nicer. With the texture, it moves around a lot less. So some of the things that most people are used to, because a friend or a relative has had an augmentation with the massaging and this and that, you don't want to do that with any of those, because if it flips, all of a sudden the fuller side ends up on the top and you look kind of lopsided.
Now this is silicone?
That's silicone as well.
Okay.
That's a grade 3 silicone. That's a grade 4 silicone. So it's
Okay.
more cohesive. So that one, if you cut it in half, it is a true gummy bear. If you cut it in half, it doesn't go anywhere. And a lot of patients are concerned about the whole silicone thing, especially if they're a little bit older. They remember the days that silicone was taken off. Everything got tested by FDA. It got approved. And even that, when you squeeze it out, it doesn't leak anywhere.
So for the people who are concerned about silicone, give them a little bit of that history about what was the concern about it, and then...
So they were concerned that if there's any autoimmune issues, lupus, this, that, whatnot, so they took silicones off the market, and then in some cases they allowed it only for reconstruction, and I believe it was in 92. or 2002, I can't remember, but it was brought back to the market again. I think it was 2002.
I think it was.
It was brought back to the market for general use again after they did all the testing and they did not find any correlation.
So for people out there
between
who are
them.
concerned, silicone is safe.
Silicone is safe. I mean, of course, medicine is the practice of medicine. If, in 10 years, if they're going to come up with something else, we don't know. But as of right now, it is safe. It is used for cosmetic as well as reconstruction. It is actually the only thing we use for reconstruction because saline looks horrible.
For reconstruction?
For reconstruction, yeah. And I personally like these because a lot of the women, it just looks really natural.
So the silicone, I worked with a physician years ago, and he would see patients that he would diagnose with silicone-related disease, SRD. And that was, around the same time. So they were diagnosed with rheumatoid arthritis, fibromyalgia. So that really...
They did not find any correlation, and that's why FDA approved it to come back. Now, the only difference between that silicone and what was taken off the market is that this one is a little bit more cohesive. So we've actually tried, we poke a hole in it and you squeeze it and it just comes out and it goes back in. It's kind of like those silly thingies that the kids play with. It doesn't go anywhere.
Oh yeah, I know what you're talking about.
So the only thing that we'd recommend is that when the gel fractures in these, and even the salines, the shell is silicone. So when it fractures, that one, it just deflates. This one, you may not know you have a fracture, and the only way it gets picked up is with an MRI. So some people may have
which one?
With the silicones.
Oh, okay.
When the shell fractures. So there's really no way of, it's not going to leak out. You're not going to lose a breast like the other one. You're not going to deflate, not lose it, really.
What is the recovery like? We talked about it before, but what is the recovery like if someone has breast surgery, breast augmentation surgery?
Breast augmentation, usually for me, every plastic surgeon has their own preferences, but usually most patients go back to work within a week. Of course, that's going to depend on what their occupation is. If somebody is doing heavy lifting and things like that, they have more restrictions compared to somebody that's a student or stay-home mom or, desk job. But usually within a week, you're fine to go back. But especially with the shaped ones, we like to restrict them for about 6 to 8 weeks as far as aggressive pushing, pulling, or exercising, just so it doesn't rotate. After that, they're free to do whatever they want.
So as far as silicone breast implants, if a person is going to get breast implant surgery, and I think we discussed this before, there's obviously people are different, but everyone's going to form a level of contracture at some level.
Right.
What is your advice to people? Like if they say, look, I'm 30 years old or whatever, what is the likelihood that I'm going to have these replaced? You say it's pretty good, right?
Usually the idea is that if it's not broken, you don't need to fix it. However, the younger you are when you get an augmentation, you are going to go through pregnancy, breastfeeding, aging. So those are things that you're not going to be able to change. And if your weight gain, weight loss, and if your body changes with these, chances are you're going to need some sort of a revisionary work done to lift it or fill it or do something to it. But as far as the fracture, the company stands behind it for 7 to 10 years.
Okay.
After that, there are patients that we've seen for 20 years. They have the same ones. It looks great, doesn't bother them. You just leave it alone.
And is there any more increased rate of contracture with silicone versus saline, or does that have nothing to do with it?
No, but some of the studies, they found that the shaped, textured one had a lower capsular contraction rate than the round gel one, based on the studies that they've had.
Now, this one right here, I see that there is some dimpling. Can you see that from different, on the outside of the body?
No, because we put it under the muscle, and it actually is kind of like when you put your hand on it and push it down. These are actually the new Inspira implants that Allergan has. They are a little bit more overfilled compared to the traditional ones, and all of these implants come in different heights. So there's a low profile, moderate plus, high profile, depending on what they want to achieve. Usually most of us put moderate plus for the augmentation, so it doesn't look too extreme. But some of the women that do want to have that more extreme look, we do put high profile. But these are more filled, so it's a little bit less dip. The other one have a little bit more dip, but you can't see it.
Okay.
And thank you for joining us. This is Ask Dr. Tommy Show. When you come back, we're going to talk a little bit more about how to learn about breast augmentation.
Surgery Center of Oklahoma is at the forefront of a healthcare cost revolution.
Healthcare really doesn't cost that much, but what people are being charged for it is another matter altogether.
To find surgery pricing and to learn more about our specialists, visit surgerycenterok.com.
I wanted to say something off film.
You can't.
Mess that up.
Well, because you used profanity.
We got to start over.
All the way over?
No.
Oh.
We got to start over. No talking during the break, unless I can tell you can talk.
I'm going to need them later. See what I have to put up with?
All right, here we go. And this is the Ask Dr. Tommy Show. When we come back, we're going to talk a little bit more about how to learn about breast augmentation surgery.
Surgery Center of Oklahoma is at the forefront of a healthcare cost revolution.
Healthcare really doesn't cost that much, but what people are being charged for is another matter altogether.
To find surgery pricing and to learn more about our specialists, visit surgerycenterok.com.
And thank you for joining us again. This is the Ask Dr. Tommy Show, and we are semi-live here with Dr. Azharian and Tracy Hoyle, and we're talking about breast augmentation surgery. Tracy, you had a question?
Yes, with this right here, we just discussed about the dimpling, but you said sometimes you can see a ripple effect.
Right. So basically, usually if somebody is very, very thin and they choose to have silicone implants, that's usually when that happens. If that was full with the saline, or we just put water for demonstration purposes, when you put them side by side, like when I had you put it, you can see all those little dips in it. With saline, you lose some of that fluid with time. It's very, very small amount, but it's enough that you start getting these little indentations in it. And when somebody's very thin, they don't have too much tissue covering it. So all of those little imperfections, which we call it rippling, you can start seeing it. So when we have a very thin patient coming in, and if they're concerned about costs or they're very adamant about going saline, we just always let them know that you could see that as soon as few weeks into it, or you could just see it, months or years down the line. Okay. So that's one of the things. Also, if somebody goes too big and their skin's really stretched out, sometimes you can see imperfections. But for most purposes, you should be able to select an implant that fits the person and kind of explain all of those things to them, and it should be fine.
So when people are getting breast augmentation, they come to you, they usually probably say, I want a C-cup or a D-cup or whatever.
They
How do you guys?
usually do. Everybody wants a C-cup. C-cup seems to be like this magic perfect thing, which nobody knows what a C-cup is. So the way we like to do it is that we have a bunch of implants in the office, and we ask them to bring a not padded, non-push-up bra and a tight t-shirt or a tank top, and we have them put these in there to give them a general idea. It's still not the same as when it's in the body under the muscle, because it pushes down. This is the best way. And so I always tell them, I'm like, okay, forget about the letter and just look in the mirror and see what you like. Because if you go from bra company to bra company, Victoria's Secret, people walk into the office that are a D cup, and you just look at them, you're like, you are not a D cup. You're barely an A cup.
So they do that for their ego.
They do. So Victoria's Secret likes to cup them, but not that there's anything wrong with that. It's just that bra company to bra company, you'll find that one company you're a B cup, the next one you're a C cup, the next one you may be a C whatever plus cup, because there's some C pluses out there. So you can't go based on the thing, you just have to go based on what fits you.
If people are interested in learning more about plastic surgery, especially cosmetic surgery, where do you refer them to go? Do you have information on your website?
So, yeah, we have a lot of information on the website. They can always go to magnoliapsc.com to read more about things. We have a gallery that they can go see any pictures about breasts, tummy tucks, whatever the case is. Or they can just call the office and set up a free consultation. We also have virtual consultations. If they're more internet people, they can fill out a form, send it, and Melissa will call them back and schedule an appointment or answer any questions they may have.
Is the American, what is the Society for Plastic Surgeons? American Society of Plastic Surgeons?
American Society of Plastic Surgeons.
Okay. And then as far as if people are also concerned about the cost of it, and they can't, there's different ways they can finance
There
it.
is always financing options. There's always, personal ways of financing it, like through a credit card that you have 0% APR. But a lot of people these days, they are either have had this in their mind, they've saved up, or they go through the financing options that are available.
Is there anything that you would ever tell someone, or what are some of the red flags when you see someone, you say, look, this surgery is not for you, breast surgery, that is, augmentation surgery?
if they have unrealistic expectations, if it's somebody that doesn't want to have any scars on them, or if somebody that is not willing to accept that they need a lift along with it, if especially anybody that is older or within the age of like past 30, we always ask them to get a mammogram to have as a baseline. Obviously, if there's any pathology found, or if someone comes in and says, oh, by the way, I feel this lump, we always make sure they're cleared. The other big thing for me is smoking. You have got to stop the nicotine use. Otherwise, everything will fall apart. You're doing this to look good. You don't want to add complications and issues to it.
So you brought up mammograms. After implants are put in, mammograms can be done normally,
Yes.
or do you have to do anything special?
No, mammograms are done normally. Most of us these days put implants behind the muscle, unless it's specific circumstances, or the patient specifically requests it. But usually when you go, there's no issue, especially now there's 3D mammograms, which are not even painful. So we highly encourage people to keep up with their mammograms. But they just have you sign a waiver to say that if in case they rupture your implants, which honestly the force is not that much, especially with the new mammograms, that they're not liable.
Okay.
After someone's had breast augmentation surgery with either saline or silicone of either variety, is there any restrictions on their activity? Can they go back to sports, weightlifting, or whatever?
Within 8 weeks, they can go back to it.
So
Before
there's
no.
never any restriction after that post-operative period.
No.
I don't have anything.
Well, thank you for coming in, Dr. Azharian. And if people are interested in learning more about it, they can come in and have a complimentary consultation with you.
Right. They can go on the website, or they can call us 813-563-2220 and to book their free consultation.
Very good. And for all of you out there listening, if you want to go to magnoliapsc.com, then you'll be able to see all about the different services that Dr. Azharian offers in addition to breast augmentation surgery. And for all of you out there listening, go to AskDrTommy.com. And until next time, bye-bye.
Thank you for joining us today.
Bye.
For more show news and information, go to AskDrTommy.com. And be sure to follow Dr. Tommy on Facebook at Echelon Health and on Twitter at Tampa Direct Care. To learn more about Echelon Health Concierge Medicine Practice, visit Echelon Health online at tampadirectcare.com.
They're big. They're the size of my head.
Good job.
850, and this is
Those
375.